You're walking through the grocery store, and halfway down the aisle, your legs start to ache. A deep, cramping pain that makes you want to stop and rest. You lean on your shopping cart, catch your breath, and the pain fades. So you keep walking. A few minutes later, it happens again. You tell yourself it's just age, just tired legs. Maybe you overdid it yesterday, but here's what you need to know. This could be your body's desperate warning sign. A sign that the blood flow to your legs is being choked off. A sign that you could be at serious risk for a heart attack or stroke. And most people ignore it until it's too late. Today, we're talking about a condition that affects millions of seniors but is dangerously underdiagnosed. It's called peripheral artery disease, or PAD. And that pain in your legs when you walk? That's not just sore muscles. That could be your arteries crying out for help. Let's start with what's actually happening inside your legs. Your arteries are highways that carry oxygen-rich blood from your heart to every part of your body, including your legs and feet. But over time, these highways can get clogged. Plaque builds up on the artery walls, made of cholesterol, fat, calcium, and other substances in your blood. This buildup is called atherosclerosis, and when it happens in the arteries of your legs, it's peripheral artery disease. As these arteries narrow, less blood can flow through. When you're sitting or resting, you might not notice anything wrong. Your legs don't need much blood when they're still. But when you start walking, your leg muscles need more oxygen. They're working hard, and they're screaming for blood flow. But the narrowed arteries can't deliver enough, so your muscles cramp up. They're literally starving for oxygen. This pain has a name: claudication. It comes from the Latin word for limping, and it's the classic warning sign of PAD. Here's what claudication typically feels like: cramping, aching, or tiredness in your leg muscles, usually in your calves, but sometimes in your thighs or buttocks. It happens when you walk or exercise. It goes away after a few minutes of rest. Then it comes back when you start moving again. The pattern is predictable. Walk a block, pain, rest, relief. Walk another block, pain again. Some people describe it as heaviness or fatigue rather than pain, like their legs are made of concrete. Others feel a burning sensation or tightness. But here's the dangerous part. Many people don't have any symptoms at all, especially in the early stages. Your arteries could be significantly blocked, and you might not feel a thing. Now, why should you care about circulation in your legs when it's your heart and brain that keep you alive? Because here's the critical connection. If you have blocked arteries in your legs, you almost certainly have blocked arteries elsewhere. PAD is a red flag that atherosclerosis is happening throughout your entire vascular system. Studies show that people with PAD have a 4 to 5 times higher risk of heart attack or stroke compared to people without it. In fact, up to 60% of people with PAD also have significant coronary artery disease, even if they don't know it. Your leg pain isn't just a leg problem, it's a whole body alarm system. Think of it this way: plaque doesn't discriminate. If it's building up in your leg arteries, it's likely building up in your coronary arteries that feed your heart and your carotid arteries that feed your brain. The same process that's causing your legs to hurt could be setting you up for a massive heart attack or debilitating stroke. So what puts you at risk for PAD? Smoking is the #1 risk factor. If you smoke or have ever smoked, your risk skyrockets. Smoking damages the lining of your arteries, promotes plaque formation, and reduces oxygen in your blood. It's basically a triple threat to your circulation. Diabetes is another major culprit. High blood sugar damages blood vessels and accelerates atherosclerosis. People with diabetes are 2 to 4 times more likely to develop PAD, and they often develop it at a younger age and in a more severe form. High blood pressure damages artery walls over time, making them more susceptible to plaque buildup. High cholesterol provides the raw material for that plaque. Being overweight or obese increases inflammation and promotes vascular damage. Age is a factor too. Your risk increases significantly after age 50, and by age 70, 1 in 5 people has some degree of PAD, though many don't know it. Family history matters. If your parents or siblings had PAD, heart disease, or stroke, your risk is higher. And certain ethnicities, particularly African Americans, face increased risk. Here's what's scary. PAD often develops silently. You might have moderate blockages and not feel anything because you've gradually reduced your activity level without realizing it. You don't walk as far as you used to. You take the elevator instead of stairs. You've adapted to your limitations without connecting the dots. Meanwhile, the disease is progressing. Let's talk about the other signs you shouldn't ignore. Cold feet or legs, especially if one leg is noticeably colder than the other. This happens because reduced blood flow means less warmth reaching your extremities. Numbness or weakness in your legs. Your nerves need blood flow too, and when they don't get enough, they start to malfunction. Shiny skin on your legs or feet, or loss of hair on your legs and feet. When blood flow is poor, your skin changes. Hair follicles need good circulation to thrive. Slow-growing toenails or thick, discolored nails. Again, this reflects poor circulation. Wounds or sores on your feet or legs that heal slowly or don't heal at all. This is extremely serious. Without adequate blood flow, your body can't deliver the immune cells and nutrients needed for healing. Pale or bluish skin color in your legs or feet, especially when elevated. Weak or absent pulses in your legs or feet. Your doctor can check this, but you might notice it yourself. In men, erectile dysfunction can be an early sign of vascular disease, including PAD. Now, if PAD progresses without treatment, it can become critical limb ischemia. This is a medical emergency. The blood flow becomes so restricted that you have pain even at rest, especially at night. Your feet might throb and ache when you're lying down, because gravity isn't helping blood flow to your legs anymore. Some people hang their legs over the side of the bed to get relief. The pain is excruciating. Tissue starts to die. Ulcers form that won't heal. Gangrene can set in. And at that point, amputation might be the only option to save your life. Every year, approximately 150,000 amputations are performed in the United States due to PAD. Most of these could be prevented with earlier detection and treatment. So how is PAD diagnosed? The simplest test is called the ankle brachial index, or ABI. It's painless and takes just a few minutes. Your doctor measures the blood pressure in your ankle and compares it to the blood pressure in your arm. If the pressure in your ankle is significantly lower, it indicates blockage in the leg arteries. An ABI of 0.9 or lower suggests PAD. The lower the number, the more severe the blockage. Your doctor might also order an ultrasound of your legs to visualize blood flow, or in some cases, more advanced imaging like CT angiography or MR angiography to see exactly where and how severe the blockages are. If you have risk factors or symptoms, don't wait. Ask your doctor about screening for PAD. Now let's talk about what you can do if you're diagnosed with PAD, or better yet, how to prevent it in the first place. First and most important, if you smoke, quit. Nothing you do will matter as much as stopping smoking. It's the single most powerful intervention. There are medications, nicotine replacement, support groups, and counseling programs that can help. Use them. Second, get your diabetes under control if you have it. Work with your doctor to keep your blood sugar in a healthy range. This protects your blood vessels from further damage. Third, manage your blood pressure and cholesterol. Your doctor might prescribe medications, and you should take them as directed. These aren't optional. They're essential to slowing down or stopping the progression of atherosclerosis. Many people with PAD are prescribed aspirin or other antiplatelet drugs to prevent blood clots, and statins to lower cholesterol and stabilize plaque. These medications significantly reduce your risk of heart attack and stroke. Fourth, exercise. I know this sounds counterintuitive when walking causes pain, but supervised exercise therapy is one of the most effective treatments for PAD. Here's how it works. You walk until you feel pain, then you rest until it goes away, then you walk again. Over time, this actually improves your symptoms. Your body develops collateral circulation, creating new small blood vessels that bypass the blockages. Your muscles become more efficient at using oxygen. Studies show that structured walking programs can increase your walking distance by 50 to 100% or more. It's like physical therapy for your arteries. Start slowly. Even 5 minutes of walking multiple times a day can help. Gradually increase your time and distance. Many hospitals offer supervised PAD exercise programs, which are ideal because you have medical support. Fifth, eat a heart-healthy diet. Focus on vegetables, fruits, whole grains, lean proteins, and healthy fats like olive oil and fish. Limit saturated fats, trans fats, sodium, and added sugars. Think Mediterranean diet. Good nutrition reduces inflammation, helps control cholesterol and blood pressure, and gives your body the nutrients it needs to maintain healthy blood vessels. Sixth, maintain a healthy weight. Losing even 5 to 10% of your body weight if you're overweight can significantly improve your vascular health. Seventh, take care of your feet. Inspect them daily for cuts, blisters, or sores. Wear comfortable, well-fitting shoes. Never go barefoot. Keep your feet clean and moisturized. If you have diabetes and PAD, consider seeing a podiatrist regularly. A small wound that seems insignificant can become a serious problem when blood flow is compromised. In some cases, medical procedures might be necessary. Angioplasty can open up blocked arteries using a balloon, sometimes with a stent to keep the artery open. In more severe cases, bypass surgery might be needed to route blood flow around the blockage. These interventions can be life-changing, relieving pain and preventing amputation. But they work best when combined with lifestyle changes. You can't have a procedure and then go back to smoking and eating poorly. The disease will just come back. Here's something really important to understand. PAD is manageable. With proper treatment and lifestyle changes, you can live a long, active life. You can reduce your symptoms, improve your mobility, and dramatically lower your risk of heart attack and stroke. But you have to take action. Don't brush off that leg pain as just getting older. Don't assume it's arthritis or muscle soreness. Don't wait until you can barely walk, or until a wound won't heal. Talk to your doctor, get tested, and if you're diagnosed with PAD, commit to treatment. Your legs are trying to tell you something. They're warning you that your vascular system needs help. Listen to them. Remember, that cramping pain when you walk isn't just an inconvenience. It's a messenger, and the message is urgent. Your arteries are in trouble, and your heart and brain might be next. But you have the power to change the trajectory. You can take control of your vascular health today. Stop smoking. Move your body. Eat well. Take your medications. Monitor your symptoms. Work with your healthcare team. Your future self will thank you. And those legs that are hurting now? With the right care, they can carry you strong and pain-free for many years to come. Don't ignore the warning. Act on it.